Well, welcome everyone. I'm delighted to welcome you to this activity, which is being organized by Healthy Heart Charity, the Cardiovascular Research Trust, of which I am chair. I'm Donald Singer. This is one of a series of World Healthy Life events, which we initiated a year ago. Our main focus is heart prevention, but there are many other benefits of a healthy life. And this is the first of our second year activities, which is going to focus on active transport. I'm delighted to have a very strong panel to talk about three different aspects, the broad aspects of this. What about pollution as a particular concern, short and long term? What can we do about active transport? And I think for the very medical people, we need to explain, I think, what the term active transport means. There's many connotations of this. So without more ado, I'm going to introduce our first speaker, Adrian Davis, who is Professor of Transport and Health at Edinburgh University. Over to you to talk about the health benefits of travel, Adrian.
Right, well, thank you very much. So good afternoon, everyone. I'm just going to talk about active travel and health. So active travel, as far as the definition goes, as far as I'm concerned, is really walking, cycling and wheeling. So wheeling includes people who are mobility impaired in terms of being in wheelchairs, but like everyone else, they need to get around, and there are many barriers to that. And there are many barriers, of course, to active travel, which largely stem from the rise of mass motorization. As mass motorization took off, we saw steep declines in active travel for very obvious reasons of perceived and actually real road danger. Now, just a bit of a context for this. We've gone through a whole shift over time, really from the 1990s, where we started to get interested in transport and health. I'm still the first professor of transport and health in the world. There was one other, I think, is now retired, but we are really, this interdisciplinary area started to grow, particularly from the 1990s, and then really took off from about the year 2000 as a rough estimate. And I tend to say that that was probably because the physical activity researchers realized that they needed to focus on routine daily living physical activity, which is walking very largely, but also to a certain extent cycling, and in some countries cycling more so than in others, of course. But we're now looking at the lens of walking and cycling and active travel generally through the prism, if you like, of the Sustainable Development Goals. And of course, that's very apposite because in a city not very far away from me, I'm in Edinburgh at the moment. In Glasgow, we have COP26, where we're trying to work out how we can, as humanity, move to a safer place in terms of climate. And that does mean decarbonisation of the transport sector, which does mean by default, at least, if not more proactively, we should be moving towards making walking and cycling much more normative than it has been for many years. So I'm just going to go back a little bit more earlier. So in time, I think maybe in world history on the links between transport and health, the very beginning might have happened at Manchester Town Hall in 1988, where a group of 7 or 8 of us met to decide that we were not happy with the way that transport and health links were being described, largely as accidents, when in fact we now talk about crashes and injuries, collisions, and maybe air and noise pollution, when we know actually, of course, now that they are very, very important, and Mark's going to go through the detail of some of the air pollution stuff. There was a really significant change by the end of the 1990s, or towards the end of the 1990s. The British Medical Association was able to bring out its report, Road Transport and Health. I was fortunate enough to be the author of that report for them. And in that, we were the first medical association anywhere in the world, unless anyone's going to point out different to me, to actually document what we thought the various health impacts of road transport were. And of course, active travel and physical activity played a large role in there. A few years earlier, the British Medical Association had written a book about cycling and health, and they'd actually done a mental complete flip-flop, a change round from thinking that cycling was a dangerous activity to realizing that even in the current hostile traffic environment of the early 90s, the benefits outweighed the disbenefits by a considerable margin. So 97 was an important point, at least in the UK, and I suspect internationally as well. It was followed in the UK very closely by a white paper on transport, which is the government's main way of telling us the new policy. this new policy under the Labour government when the 1998 Transport White Paper came out was the first time, at least in British transport history, that we actually talked seriously about health. The way we travel is making us a less healthy nation. Chronic heart disease is the biggest killer of adults in the country. Part of the blame is that we drive too much when we could walk or cycle. Now, some of that came directly from the fact that we, the British Medical Association, and I submitted our report to the Department for Transport as the evidence we needed to change transport policy dramatically. Well, the dramatically didn't happen at all, as historians of transport policy will tell you that. But we did get it for the first time ever to talk about the health impacts of road transport in a way that just wasn't there. So why active travel? Well, of course, industrialization has decreased physical activity in all spheres of life, but including habitual car use with mass motorization, swapping in place of people being active, traveling actively, whether by foot and including bus or rail journeys, where walking to stops is important, of course, as well as reductions in cycling, which has happened large scale over that time. So we were designed as hunter-gatherers to be physically active, hence the little cartoon on the top right of my slide. You know, we were designed as Homo sapiens to be physically active, and we've not outlived that biological destiny. All we've done now is, instead of going out and hunting for the antelope, chasing it on the plains of Africa, we've got in the car and driven to Sainsbury's, you know, and therefore things have changed. We emit a lot more carbon, and we don't do the physical activity, and we don't compensate for the decline in physical activity by traveling by car in one instance when we were previously active. There is no compensation behavior going on in either direction of that one. Jerry Morris, late Jerry Morris, famous grandfather at epidemiology, Jerry talked about physical activity as the best buy in public health. And of course, I'm sure the Cardiovascular Trust very much knows that line from Jerry's work, published in 1994, where he came up with that phrase. And we realized that walking and cycling are really the principal means, of, not least now in the age where we need to decarbonize so quickly, to habitualize physical activity into everyday life. You know, the first thing we want to do from once we're born and we're able to move is to walk. And we generally say the last thing we want to give up with aging is the ability to walk as well. So walking is really, at a population level, the key critical thing. So physical activity and health, this is probably very obvious territory to members joining today, that clearly, particularly for the shorter journeys, walking and cycling is an obvious way for us to make everyday journeys. Many of the journeys we make when we look at national travel surveys, whether it's in the UK or on the continent elsewhere, are journeys that by distance could easily be made on foot or by bicycle. So there's an various low-hanging fruit opportunity there. So really building walking and cycling into the daily routines is a key way of promoting physical activity, and we tried to get that through with the Chief Medical Officer's physical activity guidance, that this is a key way, you know, use the stairs instead of the lifts, and walking and cycling for short journeys. And we know that people who cycle for travel purposes, leaving out recreation for the moment, are 4 times more likely to meet their physical activity guidelines, you know, 5 times 30 at least a week, than those who don't walk or cycle. It's just obvious in a way. It's adding up your calorific minutes. So here's a nice slide from a project that the next speaker and I were very much involved in, PASTA project, physical activity through sustainable transport approaches. But I use this slide to point out the work of Jerry Morris, that Jerry Morris, you don't really need me to tell you what epidemiology is, but Jerry Morris did one of the first transport intervention studies without probably consciously thinking I'm doing one of the first in the world, but he was a man ahead of his time. And so, you know, one of the really critical bits of information which has been followed on by many, many thousands of studies looking at cardiovascular disease ever since, was when he compared bus drivers with conductors. And we know, of course, the drivers sat largely sedentary for their time, while the conductors did between 500 and 700 steps per shift, and controlling for all confounding variables, including smoking and diet, they found twice the incidence of coronary heart disease in the drivers, unsurprisingly. And the bit that I always find interesting was that he wasn't believed at his time in the 50s by medical colleagues at London School. So he went and did another study on postmen's hearts to look at postmen's delivering the mail, etc., compared to colleagues sitting back in the offices doing um, sedentary work, and found exactly the same thing. So I think, a great debt of gratitude to Jerry Morris's work, which just happened to involve a bus as a very useful way to be able to explore um, uh, the issues of physical activity. When I talk to my colleagues in the transport sector, and I've just been training for 6 hours today, so I'm slightly worn out by showing more slides, but I did show this one, and it's really to point out the numbers game aspect of the disease burden. We do a lot of focusing on road traffic injury and collisions and deaths, which we rightly should do in the transport sector. But one of the things that my colleagues in the transport sector are not very good at recognizing is that the number of premature deaths due to um, physical inactivity through cancer and through coronary heart disease and stroke are much, much bigger in terms of numbers. Now, that's not to say that we should stop our efforts in the road transport sector to deal with road traffic injuries, etc., and trying to prevent them, particularly by speed control, as a critically important measure. But we've got to recognize that as a society, we're allowing people to die from lifestyle diseases, essentially, whereby if we could enable them to be more active, not least by creating healthier environments where people choose to walk and cycle actively, maybe part of longer journeys with public transport involved, then we could tackle a lot more of these premature deaths which are coming through. So we tend to talk about these sorts of headlines when we do systematic reviews. Here's one from Paul Kelly from Edinburgh University and a series of colleagues across Europe. And we find continually really significant reductions. And this is one showing
we've got loads of money.
All-cause mortality, but if we obviously look just at reductions in cardiovascular disease-related premature deaths, the figure is higher than 10%. But there's a lot of documentation now showing that regular walking and cycling is a really great protector. And the nearest we ever get in medicine really to a magic bullet is to talk about physical activity. And I won't be the first person to have said that. I won't be the last. We must also be aware of the effects of sedentariness on weight gain. So I'll be very brief on this, but it's interesting to note the first study was probably by Bell and Popkin looking at China as the Chinese market, or China really started to take on capitalist, materialistic tendencies from the 1990s, which included mass motorization and mass, including motorbikes as well as cars. So they probably did the first study that looked at people switching between modes and saw that when people moved to a sedentary mode, they put on weight, notable weight gain. And what we find from many, many studies that have happened since is that countries with the highest level of active travel generally have the lowest obesity rates. And that's not necessarily a correlation, that's not necessarily causal, but it is a correlation of importance to note. And there have been people that have pointed out the potential for causality between these two, which does seem fairly obvious in some ways, but it's complex, of course. So there have been quite a few studies, including in the Lancet, which just shows about changes in BMI. If you go from active travel to a car, to sedentary travel, which we sometimes just call it sedentary travel now, then you add on the kilograms of weight, and if you move the other way, it tends to drop away as well. And that's obviously studies from the Biobank, UK Biobank, which is providing a lot of evidence for us across the piece. When we look at countries which have got supportive policies for active travel and the infrastructure which goes with it, because it's no good just having the rhetoric, we need the infrastructure, particularly for cycling, where you have to share the highway with motorized transport. You need to have protected infrastructure, and those of us that have traveled just around Europe can see plain enough that countries like the Netherlands and the Scandinavian countries particularly have been much, much faster to really provide this protected infrastructure, which then becomes normative quite quickly over generations, so that you get these established patterns in Switzerland for walking, where very good public transport services, the Swiss are known for, um, enables much higher levels of walking than we can achieve. And of course, the Netherlands being the outlier on the right-hand column for cycling, where walking is dampened down on the left-hand side, because so many people, it's normative for most adults in the Netherlands to ride a bike at some point as part of their daily week, etc. So when you get it right, the message from this slide is you will see you've built it and they will come in this case. I have to mention e-bikes because I think someone's going to ask me a question about it if I don't. So just very briefly, e-bikes, we've got a lot of studies now that have come out in the last 10 years, but particularly last 5 and 3 years, which show us fairly conclusively that moderate to vigorous physical activity, MVPA as we tend to call it in physical activity research, that there are health benefits associated with it, and any concerns that the engine, the motor's doing all the work is untrue, fortunately, that you do at least get moderate physical activity by riding an e-bike. And of course, any cycling, as Jerry Morris once said in a paper, is good for you. And we know that there are particular groups with conditions such as obesity and type 2 diabetes that may particularly benefit from being able to cycle with some support, because they might find it difficult, both in terms of psychologically to be seen riding a bike when they are perhaps obese, and struggling to do that in the early stages, which may put them off from doing it altogether. But there are many other benefits that come from e-bikes as well, including for people that maybe have had hip replacements towards later life, where again the weight bearing of cycling enables people to choose that. And if they get an e-bike as well, then that's probably even better for them. E-bikes, I must say, of course, are not necessarily helpful in terms of reducing health inequalities when they're still relatively expensive and out of the reach of many people on low incomes. When we look at the preventive properties of active travel, we often get asked about, well, will the disbenefits surely not outweigh the benefits? Now, we know from this, and Mark may touch on it in his presentation after me, he may have even had the same slide in his deck, I don't know, that consistently, without any bias in selection, we just find the papers, and this list only goes up to 2015, show convincingly that the benefits far outweigh the disbenefits. And that really repeats what the BMA's cycling report of 1992 said, even in the current hostile traffic conditions. So we are confident that that's okay, and we should be encouraging people to do that. I briefly put up this slide, not for you to try and read it, but just as a heuristic for myself to say that there are well-being benefits we should not miss out from talking about active travel, that this is not insignificant. Mental health has finally climbed up the table of importance when we're discussing health and well-being, and we've been doing some research. I was part of a group, came up with an international consensus statement really on commuting and well-being, noting that the people that tend to enjoy commuting most consistently in study after study are people walking, but particularly cycling to work. Now, obviously, there'll be fewer people doing that regularly at the moment, but nonetheless, that's what it found, and that's obviously got some relationship to the endorphin release that happens through physical activity. So I'm just moving to a close on my slides. I wanted to make a couple of points. That one of the problems we have, and I suspect many of your delegates today will be aware of the evidence hierarchy that we use in public health and medicine. And the worrying thing from this slide from David Hunter, who's a professor of public health at Durham University, and David put this together for 2017. It's virtually the inverse of the evidence hierarchy that we use, where we'd have meta-analysis and systematic reviews at the top with expert advice, etc., at the bottom. And yet it's at the top, and research evidence is lower down. So whether decisions are made about shaping the built environment are made in local government, which is a much more politicized environment, we have troubles because they're not really listening that strongly to the evidence that we are, as scientists, putting forward to them. I must just mention, out of at least some sort of equity, that while we are concerned rightly in the global north about, or the high income countries, about the deaths and the health impacts that come from road transport, what we're seeing in lower income countries is really a mass slaughter of pedestrians and cyclists to a certain extent, because of the copycat tendency of lower income countries' elites to want to copy the high carbon world view of transport provision that we have so badly got wrong in high income countries, by making us so dependent on private cars with the damaging effects that has on health. So I just wanted to flag up that unfortunately the poorer income countries are actually a much worse condition with less regulation than we've ever had as well. So it's a real challenge. Almost last, in order to try to break through the challenge to get practitioners, people in local authorities in the UK, to have the best available evidence on some of the issues I've been talking about and others write important studies on, there are very few ways for practitioners to read the evidence that we treat as normal. They don't have a university library card. They're not used to reading peer-reviewed studies. They read maybe short newsletter items from the Chartered Institute of Highways and Transportation or the Institute of Civil Engineers, etc. Their world is not largely predicated around an evidence base. So one of the things I've tried to do over the last decade or so is to write one-page dejargonized summary of the best peer-reviewed evidence we've got. In this one, you can see in front of you, it's called Essential Evidence on a Page. And it's just to give to busy people what we call translational research, I suppose, summaries of the best available evidence. And that is the version now that I run for Scotland. So you can get this from the TRI website, Essential Evidence for Scotland, but essentially it's essential evidence for anyone. And here's just a couple of links. I did co-author Working Together to Promote Active Travel, a briefing for local authorities for the now defunct Public Health England. So it does make me worry that the link may not be live anymore. We ought to test that. I ought to have tested it. And there's a link to my Essential Evidence for Scotland. So I've just cantered through there, Donald, and I hope that helps to kick off proceedings.
Adrian, thank you very much indeed. You really raised a lot of important points for discussion and questions. So what we're going to do now is move on to hear about air pollution and its links to health, and that as an incentive to more active transport. And we're going to have for speaker on this Mark Nieuwenhuijsen, who is research professor in environmental epidemiology at the Barcelona Institute for Global Health.
Thanks so much for inviting me to speak, and very much to Adrian as giving excellent introduction. I'll try to get on, follow up from that, but focus on particular aspects on air pollution. But fairly soon you will see that there are common determinants of physical activity and air pollution, etc. So I'm going to provide a few more I think a few important interventions that can be taken. Why is it not moving? First of all, we know that cities are hotspots of air pollution, and most of us actually live in cities here in Europe, probably about 80%. If you look at fine particulate matter, I mean, it's particular cities in the north of Italy, Poland and Czech Republic, partly because of biomass burning, but also the contribution of traffic. But if you look at nitrogen dioxide, this is particularly dominated, and levels of cities where there's a lot of traffic, the levels are very high. These are cities like Paris, Madrid, London, and the south of the Netherlands, where there's a large traffic density, and also Belgium, these particular areas. We did a study where we looked at if we could reduce the air pollution levels in these cities. These are 1,000 cities. How many lives could we save? And we estimated that if we would reach the old WHO guidelines, I must say, before the new ones were introduced a few weeks ago, we estimated that we could prevent around 50,000 deaths per year in these particular cities in Europe. But if we go to the lowest measured air pollution level in any city, we could reduce around 200,000 deaths per year because of air pollution. So this is a very large number, and probably, as you know, that a significant number of these deaths are probably through cardiovascular disease. Because we know that air pollution leads to inflammation and thereby causes cardiovascular disease, but we also know it causes many other diseases. I mean, and this is kind of an overview what kind of diseases now that we think are being caused by air pollution. So this is a very large range and touches all the organs in our body. So air pollution is a very big problem in our cities, but also to some extent on the countryside, but the hotspots are in cities. What we know also is, and this comes back to Adrian's talk, is that, you know, how our environment is designed, in particular our urban environment, determines how people get around, and this leads to environmental exposures and lifestyles and to morbidity and mortality. So this is a very simplified framework of the relationship between urban design and behavior and exposures. So what we see is that if you invest and design cities for cars, then you're going to have a lot of people using the car, which leads to higher air pollution levels, but also to noise levels. It introduces heat island effects because the temperature is a bit higher in cities where there's a lot of asphalt and concrete around. Also, car users generally have more stress, they have less social contacts, and particularly also have less physical activity. This leads to a range of different diseases and ultimately premature mortality. On the other side, if you invest and design cities for active transportation, and we see more and more cities doing that by introducing cycling lanes, for example, you get more people to walk or cycling, what leads to less air pollution, less noise, takes up less space, so you have less heat island effects. We know that cyclists have less stress, they have more social contacts, they also have much more physical activity, and reduces morbidity and mortality. So this is very important, this link. Unfortunately, what we see often in our cities, and this is actually in Barcelona, it's a very compact city, but we have also one of the highest traffic densities, motorized traffic density in our city. Our cities, are dominated by cars, even though the predominant mode of transport is often not cars. Like in Barcelona, 1 out of 4 trips are actually by cars. The rest is by public or active transportation. But if you look on the street, you think that everyone goes by car. What this leads to, we did a health impact assessment in Barcelona, is what we generally see is that the current air pollution levels from the motorized transport cause around 600 deaths per year. Also, the noise from the cars causes around 600 deaths. Then we still see a lot of a lack of physical activity, what causes over 1,000 deaths. And then from the heat island effects, we see almost 400 deaths. And because it's a very compact city, a lot of the space is taken up by asphalt for cars, we don't have so much green space, so we also see a few deaths of that. So altogether, we think that poor urban and transport planning in Barcelona causes almost 3,000 deaths. Normally, people think about the health impacts of traffic as traffic injury deaths, and we have only 30. So the hidden impacts of poor urban planning is about 100 times bigger than that we always think it is. So we need to look at solutions that are more systemic and that address many different problems what we have. And so what we need to think of is land use changes. We need to reduce our car dependency, move more towards public and active transportation, and also green our cities. So, for example, what is happening in Barcelona is the introduction of the so-called superblock. At the left side of this picture, you can see what is the current system, traffic system. It's one-way streets going left and right, up and down in the city, where all motorized traffic is allowed. We have a lot of motorbikes, but also, as what I said, a lot of cars. The idea of the superblock is to take 9 blocks and cut off the junctions, 4 junctions in the middle where you don't allow the motorized traffic to go through anymore. They go around it, and in the middle you only allow active transportation, and you also put more green space in. The idea is to introduce 500 superblocks in Barcelona. Unfortunately, at the moment, we have only 3 of them, and one of them is the Sant Antoni superblock. So this gives you an idea what is being done. So on the top, you see the situation beforehand, where you see cars driving around. At the bottom is the situation afterwards. Where you see more green space, no cars anymore. Some people walking around. This picture was taken in the afternoon, so most people have a siesta, as you know, in Spain, so not many people around, but this gives you some idea what it is. That we modeled the superblock, what would be the impacts on the environmental exposures, and what we saw that we expected around a 25% reduction in nitrogen dioxide exposure. So this is the main air pollutant coming from cars, a reduction in noise, an increase in green space, and a reduction of temperature because the heat island effect is being reduced because of more greening. And we estimated that introducing these 500 superblocks in Barcelona could prevent almost 700 premature deaths in Barcelona. Almost half of them come from a reduction of the NO2 exposure, followed by noise, heat, green space. And then only here a little bit of physical activity, because we only looked at the substitution of going from the car to active transportation. And we don't have any data yet how much more physical activity people are going to do just in the area where they live. But we expect a lot, but because we don't have any data, we didn't actually model it. But you can see, by changing the urban model, actually we can prevent quite a few deaths. And that's important. Another way is what is being introduced is the so-called 15-minute city. Paris has taken the lead. Carlos Moreno is one of the architects who's came up kind of with the idea or adapted the idea from others. And the idea of the 15-minute city is that all your destinations, work, school, shop, cultural events should be within about 15-minute walk or cycling of your home. Now, this really requires a real rethink of how you organize the city. And the way they've kind of interpreted in Paris is putting more destinations in different neighborhoods, more shops, cultural activities, etc. So people don't have to travel as much. The problem is still probably the work, because a lot of people travel often, half an hour to work. And in a way, what you would expect is to bring people closer to their work, but it's often difficult because we have kind of social segregation in cities, and so it would bring poor and rich people more together in this. But the idea is to cut the travel that people have to do, so they don't have to rely on the car, but actually can walk and cycle. A more dramatic intervention, I think, but also quite sometimes what we've seen in some cities already in city centers, is to make cities car-free. Hamburg says they're going to be car-free by 2034, not because of health reasons, but because of sustainability issues, so trying to address the climate crisis. There are also many benefits for going car-free. You've seen it, some of them already, that the reduction of air pollution, noise, heat island effects, introducing more physical activity, and you can have more green space. And there is actually a neighborhood in Freiburg called Vauban that is a car-free neighborhood. And anyone interested in how does it feel to be car-free, go to visit Freiburg and go to this neighborhood, and you never want to be, I think, in another neighborhood anymore. I mean, I still remember going there and going to this neighborhood, and it's fantastic. I mean, it's a fairly large neighborhood, sustainable housing, lots of green space. You hear the birds. People are just walking around, cycling. There's a tram line to the city center. Unfortunately, it's so popular that it's quite expensive to live there, and that's the only disadvantage, I think. But it's a wonderful place to be, and I think that's what we should be aiming for, this type of spaces. So what happens in common is trying to get people out of the car, out of motorized traffic, to have more active travel. I mean, and as Adrian said, often it's possible because many of the car trips are actually less than 5 kilometers. They'll easily be replaced by cycling, normal bike, electric bike, or the shorter trips up to 1-2 kilometers by walking. We know that cycling has many benefits. It reduces premature mortality. It combines the gym with going to work. I mean, a lot of people don't have enough time to go to work. So if you cycle to work, you have your gym time, less air pollution, less noise, zero CO2 emissions, what is very important for the climate crisis. Also, it takes up much less space, so we have more public space for other things. The cyclists are happier, and as what Adrian showed, the benefits of physical activity well outweigh the risk of air pollution and accidents that cyclists have. Unfortunately, what we often see, if there is a cyclist killed, it makes the front page of the newspaper. But what is not being mentioned at the front page of the newspaper is that many people are saved because of the physical activity. I mean, because of less cardiovascular disease or premature mortality. This is Utrecht in the Netherlands. Myself, I'm from the Netherlands, so I'm a bit biased, but I love this kind of picture where you see most people, cycling. It's very busy, very few cars on the street, actually. Most people use the bike to get around because the infrastructure is there, and that's extremely important. Have safe infrastructure to get people to cycle. We did a health impact assessment study in 167 cities in Europe. We asked ourselves if in these cities up to 25% of the mode share would be by cycling, how many premature deaths could we prevent? And we estimated over 10,000 premature deaths that could be prevented. This was part of the PASTEUR study that also Adrian mentioned. The other thing I think, when you create more space, what is important is what we see now in cities, that there is often not enough green space, accessible green space to people. Therefore, we also need to green our cities because they have many health benefits. People live longer, have fewer mental health problems. It's better for cognitive functioning, both for children and for the elderly. We see less cardiovascular disease. We generally see better mood and healthier babies. It mitigates air pollution, heat island effects, noise. It helps a little bit towards the CO2 sequestration. And replacing roads and parking that's being used at the moment for cars, for example, with green infrastructure can promote an environment that is actually at the moment detrimental to health to something that is beneficial for health. We just finished a health impact assessment in the 1,000 cities where we also did the air pollution assessment. We looked also at green space. What if all the 1,000 cities would reach the World Health Organization target of having a green space of at least 0.5 hectares within 300 meters of the residents? We estimated that you could prevent over 43,000 premature deaths per year in these particular cities. We also found out that 60% of the population don't have a sufficient access to green space because they're living too far away. As what I said, people should be living within 300 meters. If you're interested in your own city, have a look at our ranking. It's at the bottom. There's a website, iceglobalranking.org, that gives a ranking of the available green space in cities around Europe, and also what is the mortality burden related to that. And by Europe, I mean by the UK as well. It's included here as well, just to make Sure. Can we make changes? I think yes. I mean, this is an example from Seoul. I mean, where before there was a motorway, they took the motorway down, made a nice little canal with green space, fewer cars, much nicer environment to be, and much lower air pollution levels. This is in the UK, Alderley Hospital, a children's hospital. On the left side, you see the old hospital with a park next to it. They needed to build a new hospital. They asked the children, what do you want? The children said more green space, a larger park. So they built a new hospital on the park area with green space on top of it. And the old hospital was replaced by a park. So we still have the hospital with much more green space around it, much better area to be. This is one of my favorite streets in Barcelona, Rambla de Poblenou, not the main Rambla, but Rambla de Poblenou. There's a pedestrian area with many shops, but also residences, and also a lot of green space. So people can walk around, very pleasant environment, cycling lanes on the side. And it's in the summer, it's about 5-6 degrees cooler than the rest other streets in Barcelona, so reducing the heat island effect. Wonderful place to walk and cycle. We recently did a paper that was published earlier this year, the Healthy Heart Cities, where we say genetics loads the gun, the environment pulls the trigger. What we need to do is make our environments healthier, reducing air pollution levels, change our urban models to reduce heart disease, what we're seeing in many cities. It's worth reading this paper. Also, I did a paper around the new urban models. I'm happy to send it to you. You can also download it. It's accessible, where I discuss some of these new models that and some others that I just discussed to show what are the health benefits of this. And then I had a little, I did a few blogs. These are for a more general popular audience, more popular science, bringing together different ideas in the city in relation to COVID. This can be downloaded from the Amazon website. Happy to send you some as well. So thank you so much for listening. I hope that I brought down the point is that we need to improve our environment, in particular our urban environment, make it more suitable for active transportation, that at the same time then also with lower air pollution levels, and allows us to create more green spaces as well. Thanks so much.
Mark, thank you very much indeed. I think we'll come back in the Q&A about bringing the population with you. So we're going to finish now with Tom Cohen, Senior Lecturer at the Active Transport Academy of the University of Westminster. He will say more on how to promote active travel.
Good afternoon, everyone. The Active Travel Academy is a relatively new venture which is part of the University of Westminster. Technically, it lives within a school called Architecture and Cities. Our director is Professor Rachel Aldred, whom some of you may have come across. She's done a lot of well-respected work in this field. Well, the task for me to follow on from Adrian and Mark is, on the basis that you have now been thoroughly motivated to try to grow active travel, to consider the question of how to do that. And I suppose what I ought to say is that it's a case not just of how to promote active travel. If I can get my slides to advance, I think that will help, but to try to do it successfully. There's an awful lot of promotion of active travel going on, and much of it doesn't work. But what we're interested in, I think, is how to get it to work so that it isn't wasted effort, given all of the extremely good reasons that we have for wanting people to walk and cycle and wheel more. But before we get into that, I think we just have to be realistic for a moment and accept that we're, in the UK at least, facing a relatively tall order, in that it is a car driving society, whether we like it or not. And these are relatively recent figures, so they do take into account a fair bit of pandemic related activity. Nevertheless, the car is monarch in terms of trips and in terms particularly of distance. There's lots of walking going on, but as you can see, the distance involved is much less than with car because of the relative speeds. And this is obviously a worry for a variety of reasons, but in particular because all of that driving does create the kind of hostile environment that we've been hearing about already. So how are we going to get past that and into a more positive state? I should also say before I move on that our cycling rate in the UK is dismal. And I will concentrate a little bit on cycling for the simple reason that it has a lot to offer in our rather dispersed world. Walking is great, as we've heard, but you can't cover a great deal of ground on foot, and bicycle has the huge advantage of speed. And that's nicely demonstrated here from some diagrams produced by Peter Murray. This is using a Transport for London tool called PTALS. It derives from before Transport for London, where broadly speaking, a red color means that you're well connected to the network and a blue color means you're not. This is on foot, and this is people's access to bus stops and stations. But if you add in the capacity to cycle, then huge amounts more of the network become available to you. So this is Ealing in West London, and the contrast is very clear. Once you're on a bicycle, you can get to the transport network much more easily, and therefore you are connected to it much better. So this is the reason why there is a focus upon cycling. Don't get me wrong, I'm a big fan of walking, but I'm also realistic about what it can achieve in big cities such as London. However, we do have a challenge on our hands because, as these Department for Transport statistics demonstrate, a lot of people are not keen to cycle. And this actually surprises me. I would have thought it'd be a larger number who agree with the statement, but 66% agree that it's too dangerous for me to cycle on the roads. That is a very large number of people to be persuaded otherwise. Only 14% disagree, and I don't know quite what we do with the people who are saying neither at the moment. So at least in the UK, we have an environment which is not conducive to cycling. And well, we have to believe what we're told. As I say, I think the numbers are probably higher than that. Add to that the fact that we have hostility on all fronts. So this is drivers being asked to consider a statement. So not necessarily drivers, sorry. People are being asked to consider a statement. Drivers should leave enough space for cyclists. That seems to me to be an uncontentious statement, but it's nevertheless the case that only 95% of respondents agreed with it. Fully 2% said no, which suggests that they think it's okay to intimidate and maybe worse people on bicycles. This is not an encouraging environment in which to try to promote active travel. And it just brings us back to what we've been saying already this afternoon, which is that if we want people to use these modes, we need to create an environment which makes it pleasant to do so. Okay, so I have managed to depress us all by suggesting that we really do have a tall order in front of us. It's not as bad as all that, but if we do want to promote active travel, how best to do it? And I will present to you a very unattractive acronym, which does a pretty good job of describing the bulk of what has been done to date in terms of promoting active travel. This stands for, it seemed like a good idea at the time. And often you will find that if it isn't that, then people have done something because everyone else around them was doing it, or because they had a hunch that it might work. And that on the whole is not a terribly good basis for making decisions about any kind of intervention, certainly one where you're trying to persuade people to do something which isn't currently very popular. So what I work on some of the time is trying to help to define interventions which have a better chance of working. And the good news is that there's an ever expanding range of sources available to us to help us to do that planning work. This is something that came out of the Behavioral Insights team, I think before it was called that. Mindspace is another acronym. And then they soon realized that 9 characters are too many for people to handle. And so they introduced EAST, which is much easier to contend with. There's only 4 letters to remember. Most recently of this set, I think I'm right in saying, is this work, which was produced by the Department for Transport. All of the UK departments now have behavioral insights teams, and I think most of them have produced a document of this sort, saying how you ought to do it within a given sector. So in this case, transport. Now, all of these have quite a lot to recommend them, and you're obviously free to go and look at them if you don't know them and form your own opinion. The model which I use most myself, probably because I used to be at UCL where it was born, is this one, known as COM-B. There you go, another acronym, where COM stands for capability, opportunity, and motivation. And the idea is that if all of those 3 things are in place, then you might well get the behavior that you seek. Now, how does this work? Well, simply, this rather natty diagram, which has been very widely used, connects a variety of things. So in the center, the green are these 3 bits I've just mentioned: capability, opportunity, and motivation, each of which is subdivided into 2 components. And then in the red section, you've got what are called intervention factors, I think. I'd have to check whether that's right. And then on the outside, you've got the things you might actually do. You know, the terms don't matter terribly much. What is important is that there is this methodical way of going from the center, the things that we need to achieve, capability, opportunity, and motivation, to the interventions that might actually deliver these things. And it's that word methodical, which I think is important to bear in mind. As compared with, it seemed like a good idea at the time, COMBI and other such tools are very good at getting us to think things through and to avoid making basic errors, or perhaps more important, missing things that would possibly be very effective, but we didn't think about them because we were so dead set on doing what we would always had in mind. Now, it's not perfect. It has some weaknesses. It derives largely from the world of psychology and can be criticized, therefore, for being a tad on the individualistic side. I would say it's also a little bit weak on the environmental side. So what I find is that psychologists using this tool very frequently tend to veer towards communication-based interventions and not think so much about environmental restructuring. And it's not surprising, therefore, that sociologists don't particularly enjoy using a tool such as this and prefer things such as social practice theory. It doesn't matter enormously much which of these models you use, provided you use one that has some basis in evidence and you use it methodically. And to continue on the line of models, this isn't so much an intervention or a behavioral framework, it's just a way of thinking about the ways in which you might intervene in transport to promote active travel. And they all begin with E. You should always be suspicious of anything which has been forced, shoehorned into that kind of rule. But these all have their place, and I'll just go through them very quickly. We've talked a lot about engineering already this afternoon, so I won't dwell on this. It's understandable that we, in transport, zero in on the environment in which all of this stuff takes place. This is a picture from Vienna, which is widely admired for its walking environment, and you can see that it is a very conducive space in which to do active travel. Not a car in sight, in fact. And so it's understandable that people naturally think, well, if you were to create cities that look like this, then there'd be lots more walking and cycling. And there's plenty of evidence that that's the case. But it isn't the only thing you can do. And sometimes it won't be the right or the most cost-effective thing to do. Here, as a placeholder for enforcement, is the ULEZ, which has recently expanded massively in London to cover the area bounded by the North and South Circular Roads. And as you may know, if you're familiar with it, it means that anyone owning a vehicle of a certain age, likely to produce unacceptably high emissions, will have to pay a substantial sum of money to drive their car in that area, or lorry for that matter, perhaps more importantly, lorry. Now, you could argue that that's not strictly enforcement because it's a financial measure. I don't think we need to fall out over whether we should be calling it enforcement or economics, but this is a classic example, the congestion charge in London being one that preceded it, of a mechanism which doesn't involve massive environmental change, but can lead to very significant behavior change. Moving on to economics, and this is a nice one because occasionally we actually give people money rather than taking it from them. I picked this one because I'm currently involved in its evaluation. It was a government scheme introduced in lockdown to try to get people to cycle more by giving them £50 vouchers to pay for the repair or servicing of their bicycle. And you might think, that's going to work, isn't it? Well, the jury is out. I will tell you when we have the results. It's interesting, though, because it's not what we would normally do in terms of promoting cycling. We don't generally hand out money, and we don't generally think of money as being the obvious tool if cycling is what we're trying to achieve. But if it turns out to have been a success, and maybe I can say it has the possibility that it's been a success, that would be a very interesting finding in terms of bang for buck, compared with the extraordinary expense of laying new cycle routes. The last of my E's is education. And this is a vexed topic because obviously you say the word education and that almost certainly will have paternalistic echoes. And I certainly don't want to give the impression that this should be an exercise in telling people what they must do. In fact, it won't work if you do it like that. But if you indulge in a process of providing people with information, enabling them to understand what their options are, and perhaps if you work on the nudge theory of seeing how they could be doing things differently and benefiting thereby, then education certainly has its place. And this image of cycle training for young people is just one such example. There's a very broad set, including much subtler forms of communication, but this one is an easy one to pick. So to conclude, a few takeaways which I would be offering to students if they were doing my course in modifying transport behavior. So the first thing we must always understand is, why are people currently doing what they are doing? If we want them to be doing something else, we have to start with what they're doing now. And then we need to be very clear where we're trying to get to, and to be as specific about that as possible. So not simply we need to grow cycling or we need to grow walking, but amongst whom, over what time period, to what extent do we want to be more specific about the journeys that we want to convert from whatever it might be, probably car, to active travel. And then figure out what it is that's currently stopping them doing that. So thinking back to the COM-B model I introduced a little bit earlier, what is not in place in terms of the capability, opportunity, and motivation? Because that gives us the indication of what we need to do. That tells us which barriers need to be removed if the behavior is to change. And then we think, here's that word methodical again, we think methodically about all of the things we might do, ranging from changing the environment, through communication, through regulation, through offering financial incentives, in order to come up with something which might work. And always with some kind of behavioral theory in the background, because it's likely, therefore, to be more effective. And finally, and because I'm a researcher, I would say this, you then trial whatever you've arrived at and evaluate that trial in order to understand whether it worked or not, because we have thrown too much money into things in the hope that they worked, only to find that we didn't actually have much evidence either way. Not terribly good practice. And then finally, we have to try our absolute best to leave our assumptions at the door. They are many, and a good practitioner will recognize these and set them to one side when trying to develop an intervention.
Tom, thank you very much indeed, and thank you to all our speakers. To come back to you, Mark, first of all, you illustrated a number of different areas around Europe where initiatives are taking place. Can you say something about international differences in getting the message across and learning or sharing how to do this well?
I think one of the major problems we have, our world turns around money. And we've had massive investments, subsidies, tax breaks, etc. for the car. And that's why we have a lot of cars. I mean, because we created the car infrastructure that, allows more sprawl in cities and different places, people to go further, etc. So that's what we're having. I mean, I was looking also earlier this year, I think it was last year in the UK, there was a transport strategy, was something like 30 billion pounds of investments, and I think 29 billion went to car infrastructure, and then there was $500 million for electric buses, and then a bit for active transport. So, if you invest in things, that's what you're going to get, and that's the whole society is set up for that. So it's not a surprise that people are not cycling or walking as such. Where they've tried to address some of these things, like in the Netherlands, since the 70s, they've been investing a lot of money into safe cycling infrastructure. And there is where you see people cycling, more people cycling than in other places, for example. So if you invest in what you want, then actually you're going to get it. I mean, and this is not one measure, but what helps certainly is safe infrastructure, so people don't have the problem with accidents. And then there's the whole range of other things, what is around it. And, the study, what we did around the 167 cities in Europe, we saw a clear linear relationship between the availability of safe infrastructure and the cycling rate. And, the question then is, what comes first, the cycling infrastructure or the cyclist? The chicken and egg question, but that was a real indication, and you can look at that paper of mine. So I see for places like Holland, where they're really invested in cycling infrastructure, this is what you're going to get. I mean, and the same what I see here in Barcelona, for example, is also with the superblocks, changing the urban design so that you can't drive. Actually, that stops people from driving and gets people active. Also here we've introduced cycling lanes that are really increasing. We see more people cycling. There's a couple of nice papers that came out also recently, where they looked around the pandemic to see which cities invested in cycling infrastructure and what was the increase in cycling. And you saw a clear relationship with that. That's a German paper. So, you know, you need to create these opportunities for people to get active, to actually get people active, and stop subsidizing and giving tax breaks to cars, to the fossil fuel industry, because, you know, at the moment they're not carrying the externalities, they're not paying for the externalities that are being caused. I mean, the cost coming to society, the health cost, and the benefits are going to the car industry and what is related to around that, and the oil industry. And I think that's the big problem what we have at the moment.
Can I come back to you, Adrian? Obviously very topical at the moment is COP26 is happening not far from you in Glasgow, but I just wondered, to what extent do you see, you know, health benefits and active transport as something which either is there and perhaps not being pushed as much, or should be there in terms of one of the obvious drivers for less climate change?
Yeah, I mean, I'd like to almost turn that on its head in a way, because I think, firstly, to try and answer your question direct, there isn't going to be enough. There isn't going to be a voice enough for the active travel agenda within a very, very crowded event, unfortunately. I think a lot of it is going to be missed, or rather pushed to the side. What I would say is a comment about small nations is an interesting issue. That in both Wales and in Scotland in the UK, we had ministers for transport that were trying to push progressive policies which really supported active travel. Both of those ministers struggled to achieve what they have achieved, but they are working on it. But they were both elevated after the last general elections in Wales and Scotland to a more senior position, which included being responsible for tackling climate change. So my point here really is, I think the way that we're most likely, from a top-down perspective, and not to miss out on the other approaches, but from a top-down perspective, if we're starting to see that the forces that are necessary to change the big macro infrastructures around cars that Mark has been talking about, that have been fed really from the Marshall Plan onwards across Europe, are going to be attacked from the need to get to at least this idea of net zero. And that means decarbonisation of the transport sector very quickly. But it's not being driven, despite all the numbers, despite all the science, and going back to my pyramid, where the inverse of the evidence hierarchy rules the roost, that we have political guidance still dominant in the policy-making agenda. But it's likely, from my perspective, that the biggest push is going to come from some of these perhaps smaller nation states, particularly I'm just looking inside the UK at the moment, that it is Wales and Scotland that are likely to move ahead to do the things we know we need to do. In Scotland, we have a target for a 20% reduction in car kilometrage by 2030. That is a very tall order given the direction of travel so far. But I think in Scotland, and to a certain extent in Wales, the infrastructure is starting to be put in place to change the mentality, because ultimately it's a culture where many cities and locations outside, particularly Glasgow and Edinburgh, have always thought you just build extra capacity into the road network to deal with congestion. And we've got this sort of agreement now that we've come to the end of the road, to excuse the pun on that we've actually got to stop doing that in its entirety. It is, you know, if you build roads, you'll get cars, and we need to build cycle paths and better pavements so you get more pedestrians, you get more people choosing to cycle. So I think it's this move up on the focus on the climate, which is going to actually lead to more changes, certainly in the UK context. And sadly, really sadly, the health message, despite the science, is not getting as heard as it should be.
Thank you, Adrian. A couple of questions in the chat I want to come on to, but before that, how do you handle aging populations less mobile?
Well, you could argue that these represent some of the more challenging groups in which to achieve the behaviour change, but we've heard about e-bicycles already, and they certainly seem to be part of the solution because, amongst other things, they seem to extend the period of one's life in which cycling remains feasible. So they seem to be a relevant consideration. It's not unrelated that older people are often those who are found in rural areas. And again, there's been a tendency to fixate upon the urban environment where talking about active travel, and for good reason, because active travel is easier to promote in urban settings for reasons of land use, and because we tend to have a density of public transport provision, which makes it much more practicable. Out in the countryside, as I say, where you might well find more elderly people, it's less easy to do. So looking for, and again, we're aping the Netherlands in saying this, looking for means of connecting settlements by means of cycle tracks which run alongside roads or perhaps even cross country is one thing that we need to be doing in order to tackle this very thing. And particularly because implicit in your question is that as people age, they may get to the point where they're no longer able to drive. So quite apart from the public health aspects we've been talking about and the climate change aspects, you get into a social inclusion argument that people might be unable to participate fully in life because they are in effect isolated. We have a new motivation for, or an additional motivation, if you like, for wanting to enable them to travel actively, because it will, all being well, allow them to participate more fully in their social networks. But I suppose to come back to your question, they are amongst the most difficult constituencies to work productively with, because there are additional barriers, and as compared with, for the sake of argument, 8-year-olds or 15-year-olds, or for that matter 25-year-olds, there is less room for maneuver. But there's certainly stuff that can be done, no question of that.
Kieran, can I ask you to comment in a second? But before that, just the questions from the chat. And it's, what about people acutely ill, ambulance access? One of our delegates is a surgeon. She says cycle paramedics are a good way to, at least for the less severe patients.
I mean, I think, again, this was reported. I think I saw it somewhere. There were some stories in the Daily Mail about this, that there was, we close off the streets, the low traffic neighborhoods, and then the ambulances can't reach. And actually, when they looked into it, it was a non-issue. I mean, that always happens with this kind of things. I mean, so I wouldn't put too much emphasis on this or address it too much, to be honest.
So a question for Tom, perhaps. Looking at the health analogy in the UK, and it's similar in most of Europe, for example, the typical spend on public health, that's to say education, is only about 1% or less. UK is 0.7%. We spend too much time fighting fires. And the question here is, what are your views on the balance that should be going to promoting education about active transport versus the effort to build pathways that people may not use as much if they're not aware they exist, for example?
It's a fair question, and I'm afraid my answer will not satisfy, because it will depend on the circumstances. I would say just building infrastructure and hoping that people will learn about it is probably foolish. I would also say that trying to promote transport offer which is frankly rubbish is also foolish. And so some sense of where you're starting from is crucial. It's necessary to bring the facilities up to an adequate standard, and there are lots of different ways of doing that. It doesn't necessarily mean building high-end cycle lanes. It may mean something such as a low traffic neighborhood, which is very inexpensive and which does effectively remove traffic and make for a more pleasant environment in which to walk or cycle. But those things on their own are not likely to be as successful as if there is something of a charm offensive associated, if only in the form of making people aware. But generally it's worth doing more than that, and trying to convince without being heavy-handed about it, so that people see that this is for them and that they stand to benefit from it.
Thank you, Tom. And a further question from the same delegate, Matt Hill, who says he's a transport professional. So I just wonder whether you've got any advice for him in terms of how you persuade the public about less premature death.
Well, I mean, I do. So because it's such an important issue, and I've been involved in helping the Welsh Government at the moment, working towards implementation of national 20-mile-an-hour speed limit from some midpoint in 2023. So we'll go down to 30 kph in most locations in areas which were higher than that beforehand, which were 30 miles per hour. We'll go down to 20 with some exceptions, such as industrial estates and whatever, that have got no place function. There aren't pedestrians walking around them, etc., etc. So in terms of that, I've been arguing very strongly we need a national conversation with the public about what you're getting and what's going to be taken away from you. This is classically a social marketing endeavor where people are nervous of what they lose. You know, that loss aversion is pretty central to the human way of thinking. So we need to make sure we are explaining to people fairly carefully, simply, what are the benefits that are likely to accrue from any changes that happen. Of course, with 20, there are many advantages from reduction in the kinetic energy in the system, which then leads to reduction in crashes and reduction in the severity of any injuries, the likely reductions in air pollution, the better quality of life, social interactions, the likelihood of neighborhood connectivity increasing as the effects and noise of motorized traffic diminishes with 20. It's interesting, a study recently from Lausanne in Switzerland pointed out the authors thought the biggest positive impact of 20-mile-an-hour speed limits over higher was the reduction in noise, because of the effects ultimately on the cardiovascular system, as well as simple things like sleep disturbance. So I think there is a real need for a big conversation with the public about this. Obviously, when you're doing something nationally, then you may have the resources, but there's always a challenge about how to reach the wider audience when we do have social marketing obviously working, not social marketing, social media working often against us, because there are definitely people out there that are trying to undermine the message.
And Mark, within, I suppose there's two constituencies, if you like, the policymakers to persuade to make the change, and also the public to get on board to adopt. To what extent are you using the health message as opposed to the short-term safety accident message as a way to encourage people to take this on board?
Yeah, I must say that what we're trying to do is, what we also have this website, isglobalranking.org, where we look at what is the health impact of air pollution at the moment in different cities, and we do study after study on this, and also for other health effects. And I must say that our mayor here in Barcelona is very happy with our messages, because she thinks that the health argument other politicians can't argue with. So if you make the health argument that you need to lower air pollution levels to reduce premature mortality, to reduce childhood asthma, we're working on childhood asthma, we're going for the children aspect, that's most of the time it's a bit closer to people, to be honest. We find, she says, then we can reduce traffic, we can make changes. And for example, one important policy they've introduced is here to pacify the traffic around schools. We've been working with them, measuring air pollution levels around schools, finding they're much too high. So now they're suggesting, or they're doing it actually, they're reducing traffic around 100 schools here in Barcelona. And because the way the schools are placed, that reduces the speed and the traffic in the whole city. If you only do it for air pollution, people will say, but it's only air pollution. But if you link it to health, it's more convincing, and you can't argue against that. And so that it seems to be more effective. How much exactly, we don't know, of course. And then also to say that, to be honest, I'm a bit jealous of COVID-19, because you have a virus that you can link directly to health outcome. Unfortunately, for air pollution, we can't. We don't have a biomarker from air pollution that causes cardiovascular disease, or premature death, or even childhood asthma. We have the kind of epidemiological studies, often people say statistical associations, and they degrade the evidence already quite quickly, and that's what I often hear. But so we try to stay away a little bit from premature mortality, but focus, for example, on childhood asthma, because people think in general that it affects people's lungs, air pollution. They don't think about cardiovascular disease, although the largest impact is on cardiovascular disease. But people can understand it affects the lungs, and then also people want to protect children. So that resonates more with people when measures have to be taken. And also what we see, the pressure groups here in Barcelona that particularly work on children, trying to provide them a safer and cleaner environment. And I think there is where we see more action. And of course, we have a Mayor Ada Colau, who at the moment is in Glasgow, and you may see her there. But she's quite supportive of the work that is ongoing to make, reduce the traffic density in the city and reduce the air pollution level. So that helps.
Thank you, Mark. Kieran, over to you for questions you've got for the panel.
It seems to me unusual in a way that agendas, different policy agendas, come together so perfectly, environmental, both locally and globally, with health, public health, obesity and mental health, which are probably the two single biggest issues in health, and all of these things point in exactly the same direction. And we have an enormous organization, the National Health Service, I mean, one of the biggest organizations in the world, with a budget of nearly £200 billion, and seems to contribute absolutely nothing in this agenda. The only things I've seen it do recently have been to make it easier for staff to drive. That's the main things they've done after COVID. Have people seen any examples of where health services have actually done anything to contribute to the active travel agenda?
Improve radically the services for people arriving by active travel, and you can obviously do things like improve bus services, and there are examples in Merseyside of bus services congregating at hospitals. So it can be done. It may just not be in the primary interests of an organization which is motivated by the overwhelming need to deal with primary healthcare problems. That someone is ill, someone is hurt, someone needs attention now, and that's naturally the headline grabber. The NHS is always going to struggle, unless it's fundamentally reconfigured, I would suggest, to be an organization orientated towards public health.
I think one of the things is, though, with hospitals, sometimes what we see, they're being built on the outskirts of town, where it's cheaper to build and whatever. And actually, where we need the hospital is right in the center, where people are actually living, so they don't have to travel far. Yeah, that's what we have here in Barcelona. Every neighborhood has its own polyclinic where you can get a lot of things done, and only for the major things you go to the big hospital. And of course, that's also quite close, because Barcelona is quite compact and it's not so far to travel. I mean,
Scarlett McNally, is a surgeon, she's also an exercise champion for the College of Surgeons in the UK. She's more or less asking, why don't we have 20-mile-an-hour limits all over? Why shouldn't this be happening?
I mean, I can say from I've spent a lot of time, and I'm spending a lot of time now evaluating 20-mile-an-hour schemes. We've got one in Scottish Borders, which is a large area, very rural, which one of the things it's doing is providing us with evidence which fills a gap, where, because most of the 20-mile-an-hour schemes in the UK and elsewhere around the world have been very urban. But we do have good evidence now for the effectiveness of 20-mile-an-hour schemes which don't involve any traffic calming. They do bring down speed significantly, if not down to 20, but it's an important drop. And there does seem to be a tide is turning. But what we need in England, because I see that reference, I think from Scarlett, we do need political support from the centre, which would then command the Department for Transport. And don't hold your breath, because it's not going to come, not under this government anyway. It will probably come in Scotland, because Scotland's watching very closely what Wales is doing. And Scotland has just had an agreement signed with the Green Party, who are supporting a slightly minority Scottish SNP, Scottish National Party government. So I think 20 is likely to come as a default in Scotland in a not too distant future.
I would only add to that I think we as humans have a desire to travel as quickly as possible. It's in our system, it seems. And so, quite apart from everything else that's been said, which is quite true, political support and so forth, there is a sense of anathema when we have these vehicles that are designed to go at speed and we're being told to go what may seem perversely slowly. That's a culture change, which is going to take a while. I think we'll get there, but it will require quite a lot, given this fundamental urge within the human psyche to go quickly.
It's true, but you know that the problem is people often don't stick to the speed limits, and I think that's a problem. But what we see in many cars now, they introduce this advanced driver's assistance systems, And at the moment, they are very much focusing on silly things, but what they should do is focus on the speed of the car, so that the cars stick to the speed limit wherever they go. I mean, that seems to be for me, one of the most effective measures to keep speeds down. But I think they're not being introduced at the moment, but this should be by legislation being introduced, I think.
So on that point, Mark, can I just ask all three of our speakers for any final comments and thoughts? You, Adrian, first of all.
From me, I think we've got to do a very fast manoeuvre, which probably comes from decarbonisation, as I mentioned a bit ago. And we need bottom up, top down, and we need to throw the kitchen sink at this because we've got to do it so quickly. So we do need big, strong messaging campaigns, and we do need to do the environmental changes, but help people to make those changes along the way. And that does need to have, unfortunately, I use the phrase, brave politicians.
If we are to achieve behaviour change, we need to be careful and methodical in our approach, because that is how to get there.
So I would ask people to think about a 15-minute neighborhood. I mean, and use that, how do we get there? And then at the same time, stop throwing money at things that we don't want. So don't keep investing into the car system, as what I would call, but invest in the system of active transportation and public transportation for longer distances.
Thank you, Mark. And then Kieran, as our organizer, any final thoughts from you?
Just to say thank you. It's been very stimulating and lots of things to think about it, and I really enjoyed it. Thank you.
In closing, many thanks are due to major support from UK Medical Society, the Fellowship of Postgraduate Medicine, as well as to our partner organisation in Hong Kong, the Institute of Cardiovascular Science and Medicine. I also thank my colleagues at the Healthy Heart Charity, the Cardiovascular Research Trust, who are organising these World Healthy Life activities. And thank you to all three of our speakers for a tremendous session. So thank you all very much indeed.